lot of arthritis. Now this client was really good about cutting out all treats, started measuring out the amount of food she was getting, and increasing exercise, and that's all we did. Same type of food, just less treats, less of the food, and increasing exercise. And so you can see over time, this dog dropped down to 70 pounds, where we actually call it a 3 out of 5. Now, you can see at the end of the chart, the last time the dog was in, we started to get back up there. But even 80 pounds is a lot better than 95. So it can be done. If all those things don't work, we do have a medication we can use. And I mentioned this just as one of those options to help lose weight. It's a drug called Slentrol. It's made by Pfizer. It's the first approved weight loss medication for dogs. It's not for use in cats. It's not for use in people. But it is to use in dogs. Basically, the way it works, it suppresses the appetite. And it does that by the fat cells instead of being, or the actual fat that they eat, instead of being absorbed, it stays in the cells in the intestine. And so it increases the feeling of they're full and they don't need to eat anymore. And so they don't want to eat anymore. 10% it does very small amount actually block the absorption of fat, but that's not really the main way it works. It is a daily oral medication. We do recommend some blood work before we get started to check some other things. Now I will say I've used this on a couple dogs, but the one that I used it on that had the most success was a black lab who was 140 pounds, and he should have been about 85, 90 pounds. He was absolutely obese. And the two owners, the female owner was the one who always brought him in, and she always blamed the husband. And so he just feeds him too many treats, and he just won't stop feeding him. And so we talked to her, and she was able to get him to agree to go on this medication. And so then we kind of got the husband trained that the dog didn't really need all that food. And over time, this dog got down to 95 pounds. So, and stayed down there. So stayed down to 95 pounds. A year after we were off the medication, we were still at 95 pounds. So that's a huge difference in weight and just a huge difference in the quality of that dog's life. So it does work. It doesn't work in every case, but it does work in most cases. So we'll talk a little bit about exercise, and Anthony brought Rusty up. We're actually going to demonstrate a couple exercises you can do even on your severely affected pets. But our main goal with exercise is to improve function and quality of life. And so that's our main goal. We can achieve that goal by doing some of these other things. Exercise just helps loosen up the joints, decrease pain, improve muscle strength. One problem we have with our older pets, with arthritis, they don't use their limbs as much, and so their muscles atrophy. And so then we have kind of two problems instead of just the arthritis. And so we're going to help improve the strength and actually retard that atrophy. The more we use our joints, the less swelling we can get out of things like that too. And so exercise has a lot of benefits. One of the exercises you can do at home with your arthritic pet, or with any pet really, is passive range of motion exercise. And we're going to demonstrate that on Rusty. So, you want to bring Rusty over here? We're going to try to have him right here so hopefully everybody can see. This is Anthony. He's one of our technicians. And his dog Rusty.